Hi, I'm Dr. Desmond Ebanks, and I'm the founder and medical director of Alternative Healthcare in West Hartford, Connecticut. I've been a physician for over 30 years. I am a board-certified internal medicine specialist, and over the years, it was really due to frustrations that I felt in medicine that caused me to think about and create alternative healthcare. And there's two main reasons. One is what I was able to deliver and what most doctors are able to deliver to their patients, and the other is the manner in which it can be delivered. So the what, right? I mean, we don't really have a healthcare system. We have a sick care system, right? Now, and it's great when you have a complex medical problem, or you have an injury, or something traumatic, or you have a very serious diagnosis that needs to be dealt with. Then our system, this is the one that you want to have. But it's not very good at keeping people well, right? It's focused on just dealing with the immediate symptom very quickly with a prescription or a procedure, and not really getting to the next question, which is why. And that's what we focus on. We focus on getting to the root cause of a problem, and addressing that. And oftentimes, people come to us and we're able to get them off of medicine and reverse their disease. And in fact, this is not hocus pocus, right? It's in the scientific literature, and it has been for decades and decades and decades, that we know that at least 80% of the chronic diseases that will negatively impact, or could negatively impact your life or your quality of life, or shorten your life, are preventable or reversible. And this is what we focus on. That's the what. And now, or the how, I should say, and the way in which things are delivered, really is not conducive to keeping people well, right? You need more than a few minutes with your doctor to figure out, a plan of action to keep you well. But the system has turned healthcare in the U.S. into a volume-driven business. That's why most office-based, if you're talking about primary care, family medicine, internal medicine, pediatric, they have thousands, 5, 6, sometimes 8, 10,000 patients they're responsible for. And in a given day, they may see 20, 30, 40 or more patients in a day. So, you just do the math. There's only so many minutes in a given day that a doctor can spend, with a patient, asking questions and actually figuring out, what may be best for them. And certainly in between visits, it's a very limited amount of time that the doctor will be able to think about or research or, even keep abreast, of some of the latest, technologies and things that can do to benefit their patients. So, those are the two main reasons that brought me to, create alternative healthcare. And the benefit of eliminating, the third party, I would think, it would seem obvious, right? If you're talking about, if you want to buy a new car, you went to the dealership, you picked it out how you wanted it and whatever options, etc. But then they had to call a third party who then decides what they're willing to pay for. Chances are you're not going to get the car that you want. And this is where we are with healthcare. So, this is just a brief summary, of what we do. The biggest challenges, starting out, was just getting people to understand. 13 years ago, the idea of a direct pay concierge cash-based practice was foreign to most people. So there was a big educational component to get people to understand why that may be, in their best interest, and why insurance may not necessarily, be in their best interest for this type of service. And then really since then, it's been about, the marketing and the outreach and the social media, all the things that I'm not expert on, but are necessary things in order to, create, awareness and, drive business to us so that we can, keep our technology upgraded and, accomplish our mission of changing the way healthcare is delivered. So thanks for watching, and I hope that you guys give us consideration, to get some services to help us, improve what we can do, for our patients and for the community in which we practice.